Hello, welcome to Cognitive Theory. In this presentation, we will be exploring how thoughts impact behaviors, practice principles and settings, and the strengths and limitations of cognitive theory. Group contributors include Andrew Duckworth, Samantha Garcia, Ruby Granlund, and Shanquan Jackson. First, we'll discuss what is cognitive theory. Cognitive theory suggests that thoughts, not only consequences, influence our behavior. How this behavior is viewed and its consequences influences the decisions a person may make. Practice principles. Cognitive theory draws on various principles for practice. These principles assist the worker in creating a structured treatment for the client. The principles in practice are seen in therapies such as cognitive behavioral theory and RET. The most agreed upon principle of cognitive theory is that thought influences behavior. These thoughts include preconceived beliefs and values. Additionally, acquiring behaviors is considered to be a process which involves social learning. Another basic tenet of cognitive theory includes the use of rewards and punishments. The more rewarded a behavior, the more likely it is to be repeated. Whereas the more punished a behavior, then the behavior is less likely to be repeated. Practitioners also look at the client's environment to recognize the reinforcers and punishers that influence behaviors. One way social workers help to orient clients is through the process of modeling. For instance, when social workers speak openly with clients about difficult topics, they are modeling behaviors that the client can use when engaging in other relationships in their lives. When using cognitive theory, it's important for a social worker to ask about what happened before a behavior. This can help the worker better understand what may have led a client to a specific decision. This is considered antecedents of behavior. A social worker uses exploratory questions in order to examine the meanings the client attaches to their experiences. The Socratic questioning assists a social worker with identifying dysfunctional or erroneous thought patterns. Dysfunctional thinking and automatic thoughts lead social workers to evaluate a client's schema. Schema may include the client's core beliefs, which facilitate the emotions and behaviors fundamental to the client's challenges. Practice settings. Cognitive theory has informed various treatment models and interventions, including rational emotive therapy, cognitive restructuring, cognitive constructivist, Beck's model of cognitive therapy, cognitive processing therapy, mindfulness-based cognitive therapy, and cognitive behavioral therapy, used in conjunction with behaviorism. Practice applications in social work of cognitive theory are largely interventions at the micro level for individuals, although some interventions can also be used in group settings. Various studies have shown the diversity of application in which cognitive interventions can be applied. For example, some studies have shown RET effectiveness for diverse systems treating individuals for drug and alcohol abuse, as well as for teachers in schools to better control their emotions. Other interventions, such as cognitive restructuring, have been found effective for individuals with social anxiety, although it is not limited to these applications. Practice settings for cognitive theory approaches can include hospitals, community-based health agencies, schools, nursing homes, mental health clinics, and group homes. Cognitive theory interventions can be widely adapted to these various populations, allowing for treatment at the individual or group level. Cognitive theory is considered evidence-based, asserting that behavior can be studied objectively with control variables resulting in causal relationships that can be reproduced in controlled studies. These studies have made significant contributions to developmental psychology and applied interventions such as cognitive behavior therapy, which has demonstrated effectiveness with broad application with multiple populations. However, there are also limitations to cognitive theory. Cognitive theory categorized behavior is a result of a mechanical thought process. This assertion does not align with social work values that assesses person and environment and calls for a strengths based approach that honors self determination. Cognitive theory is problem focused, emphasizing individual cognitive function without consideration of environmental, cultural, or biological influences. This approach places the social worker in a positive position of authority as the expert. Marginalized populations are at greatest risk of harm with this approach as it imposes the values of the dominant culture of the social worker on the client. Thank you for taking the time to listen to our group presentation on cognitive theory.